edition number 2. We are here because you requested. So today, while our theme still remains leading in uncertain times, governance, legal, and HR issues that organizations have to consider, we'll have a strong focus today on proactive risk management for recovery and resilience. We have seen that the disruption caused by the pandemic has changed the risk profiles of organizations and has also questioned the effectiveness of existing risk management strategies and frameworks. And so as we move forward with recovery, organizations must interrogate the blind spots and weak links exposed by the impact of COVID-19. I have with me Jacqueline Oyuyo Givinji. I'm sure you all heard me say she was my classmate. Jackie, welcome. And Raimond Molenje. Welcome, Raimond. We are joined today by a special someone, an expert, an insurance guru, Mr. George Alande. And of course, I have with me Salome and Ernest Mwanzi, working on making sure that our live stream on Facebook is tip-top. So without further ado, I will move straight to some of the key questions I have that I think will lead this discussion today. So Jackie, for starters, what do you think are the key risks that have been triggered by COVID-19, from your perspective?
Thank you, Helen, and thank you once again for this opportunity to address our participants on the legal and governance issues that have arisen in the wake of COVID-19. Let me start off by saying that since our last webinar, we've had 2 presidential proclamations. Firstly, on the 6th of July, which I would summarize as, let's open up the economy for purely economic reasons. And most recently on the 27th of July, which was more targeted towards behavior change and specifically our behavior around alcohol and how that is impacting the spikes in the spread of the pandemic. Having said that, I think we seem to be struggling as a nation with how we approach COVID-19. Do we approach it as a public health issue or do we approach it as a security issue, even as we attempt to contain it? To your specific question around the risks, I think for any organization, there are 3 key risks that would face you right now. First and foremost, your strategic risk. Are you still able to deliver on the strategy you had established probably at the end of last year? And you said in 2020, these are the goals we've set for ourselves. This is how we want to achieve them. Is that still viable in the wake of the pandemic? Likely not. So what measures are you taking then to mitigate that strategic risk? Secondly, liquidity. We're all struggling in terms of financial impact, economic impact, whether at an individual level or at a corporate level. So what measures do we then take to build a little more resilience into our financial structures? And then operational risk as well, which ties in with your strategic risks. Your activity at activity level, what is it that has been impacted by the pandemic? What can you still do? What can you not do? I would summarize those as the 3 key risks that are facing every organization in the wake of COVID-19 today.
Thank you, Jackie. Raimond?
Sorry. Yeah, thank you so much, Helen. And it's also a pleasure to be able to join you once more, just to be able to continue having this conversation around the challenging times that we are living in. And as Jackie has clearly indicated the broad risks, mine is just to be able to highlight a bit on the narrow risk, on the people aspects, where we actually, because this whole scenario, it's actually a health concern, which we've been in, we are continuing to be in, and even as the projections indicate, it's something that is going to be with us for the next 2 years, and even at some point for a very unforeseeable future. So everything has actually been turned upside down. So as we even look at the strategy, as we even look at the people that we are having, is of key concern, just to be able to ensure that, yes, are we first and foremost safe and healthy? So that component is quite key. And just to run you through the numbers, as of yesterday, we know that as of yesterday now, we have moved to the reported infections to 19,000. And then now we actually have the positive side, the recoveries, which are at 8,000 plus, which is quite a very big positive. However, as a country, we are still very low on how we are testing our people. So we are still yet to get to 300. So I think yesterday we were at 289,000 and slightly above 289,000. And then also, as of yesterday, unfortunately, on the fatalities end, still there were 12 more deaths, bringing the number to 313. So these are actually very innocent lives. And that's such a huge number, 310, to be able to lose in this particular circumstances. It's quite unfortunate. And as we move forward, our key concern, risk, which is actually not even from a corporate aspect, but even from a personal level, is yes, how are we working on this health risk and actually the survival aspect of it, in that am I taking care of those around me? Am I taking care of myself as a person, so that yes, the infections will continue going on, but we have to ensure that as much as possible, we really reduce on the fatalities, because as it is, we've all been aware of it in the media, in that for us, we're in Nairobi, we have no beds. The bed capacity is actually full, so it's a very key concern, very serious risk, in that yes, even if you got in an accident today, leave alone COVID, you may actually not have an ICU bed to be able to handle you for actually a condition that will actually have been easily handled were it not for COVID. So at a personal level, and then at corporate level, we really need to look at the health aspect and everything around our survival. And so in this conversation, we'll have quite good conversation on how we need to take care of ourselves, and then now how we need to take care of our colleagues, and then now how do we need to take care of our businesses to sustain them, and even to ensure that we are thriving. So thank you.
Thank you, Raimond. George,
Yes.
what do you think, from your perspective, are the key risks triggered by COVID-19?
Thank you very much, Helen, for inviting me to this. And I think I will not want to repeat what my colleagues have already discussed for the sake of time. But I think one of the key things that we need to think about now, which is outside the norm, is the data privacy risk that now comes with when the people are now working from home. You remember in some jurisdictions like in Europe and Americas, if at all you leak some of this data, you will be actually fined and pay heavily. So these are risks that we've never been thinking about it, but it's something that all organizations now need to start thinking about, the data privacy risk, because people are working at home and all that. But one of the critical one that I think that is out of norm with the COVID-19 is what I'll call social risk.
Mm-hmm.
Currently, we are not be able to socialize with each other, to be able to give each other emotional support, mentoring, and more so just to feel that you are together with the rest. And this is very critical. And as you'll be hearing from us thereafter, this actually is also leaning to brutalities that we are seeing at home. Since you can't pent up your emotions from outside, you start boxing your mates and your children in the house. And I think the legal fraternity have a lot of work to do. So I'll say those are critical. And the other thing is what we'll call legal risk. The legal risk, we are going to come in with the issue of the COVID because we owe duty to all the employees and the client that comes to our offices who need to be served. So this legal risk, in the event that I contract COVID because I've been asked to go and work and my employer did not give me proper protection, then basically what do I do? There's some legal risks that the organizations need to think about. Among other things, I think those were the things that I would want to add for what our colleagues have already brought in. Thank you.
Thank you. So I'll ask that you, all three of you, hold that thought because we'll come back to delve into that a little bit more. The second question I had is, so what's the impact of this COVID-19 on, basically the risk appetite and tolerance for organizations? And that question, as you respond to it, look at the second arm of it in terms of what needs to change in the risk framework to better manage uncertainty and crisis. Because it is one thing to talk about having, this healthy risk appetite, but COVID has demonstrated that really we didn't have healthy risk appetites the way we thought we did. Yeah, so once again, I'll start with you, Jackie.
Thank you, Helen. I may have to step back a little bit in order to answer your question. So some of the broad consequences of COVID-19, obviously loss of lives, loss of livelihoods, and as George mentioned, domestic and gender-based violence, there's child abuse, neglect. There's such a broad range of consequences that I don't think many organizations had ever foreseen in what we typically call a business continuity plan. So business continuity plan is essentially a document that asks you to very critically look at your operations and then determine if something was to happen, if a crisis was to occur, how long would it take your business to recover from that crisis? And what would you need to keep doing to keep the business going or to aid the process of recovery? So that's a very highly summarized reference to what a business continuity plan is. And if you look at it a little more broadly, it also looks at, for example, the disaster recovery from an IT perspective and where you might be able to work from when you're not able to work from your primary premises, as many people, have found themselves in the last few months. So if you don't have a business continuity plan, then do you have, for example, a stakeholder engagement plan? So how do you engage with all the touch points of your organization? Raimond has talked about your people, those are your internal stakeholders. You have external stakeholders, your entire value chain, basically your suppliers, and also the people that you serve. So your customers, your clients, whatever name they go by. So looking at that whole value chain, where do your risks lie? So the whole process of risk management assumes that you have identified your risks, even at a very basic or pedestrian level. You know that, for example, there's a risk of not getting finance. Well, that's one risk. There's a risk of my staff not being able to come to work. There's a risk of my staff contracting the virus. And if they do, then what happens? And when you broadly look at risk, then you have to identify the impact it would have on your organization. Is it high? Is it medium? Is it low? And how you look at that is the likelihood of occurrence and then the impact it's going to have on your organization. That's what determines whether it's red, amber, green in terms of high impact, medium impact, or low impact. And then you rank your risks and you track them on a frequent basis. It's a cycle. It's a never-ending cycle because the risks also morph. We never imagined that we would be having to consider giving psychosocial support, for example, to our staff in terms of having to cope with the consequences of COVID-19. Or even for ourselves, how do you detox? How do you, take time out? When do you break? I think pretty much everybody I know has been suffering Zoom fatigue, whether you are in business or whether you are providing services, or whether you are a student, this has become, as George has said, this has become the way we connect with each other. We're connecting online for those who can afford to, which is another issue that we need to be thinking through as employers. Are we sidelining any population within our sphere of influence? So in terms of our risk appetite, I think we have seen, Helen, that we didn't quite know what a crisis would do to our businesses. We had always looked at it from, I would say, very technical perspectives in terms of the risks that I think all three of us mentioned, but we never looked at possibly the social impact as well. So in terms of what we need to do to change, I think as a business leader, as a member of a board, a council, wherever it is you're sitting, I'm going to reiterate what I said last time in terms of taking a holistic perspective and then providing leadership. And obviously, there are also sectoral considerations depending on which sector you are in. But as a leader, you certainly need to activate your networks. You need to, the reason you are appointed to a position of leadership is because it is presumed you have a certain sphere of influence. So who can you leverage, and where can you place some emphasis in terms of bringing a spotlight to your industry, to your business, to your people, so that you're able to assist in providing solutions. So when you ask what needs to change, I think it's in our agility, our readiness to respond, and to respond in real time, because certainly as boards, you meet your people on a quarterly basis. If you're not a dysfunctional board, you meet on a quarterly basis, you receive reports and you give feedback based on those reports. However, these reports are now coming in fast and thick on a daily basis. Sometimes twice a day even, you'll receive, disparate reports on different issues. So how quickly you process and then give guidance to your management becomes an aspect, of agility that you need to demonstrate from a point of leadership. And like I mentioned also, figuring out how to provide the psychosocial support where it's necessary. And it is very necessary in the current dispensation. We all think we're coping. We're not sure whether we're coping. And at the back of everybody's mind, every time you cough, sneeze, have a chest pain, or even joint pain, you're asking yourself, has it finally caught up with me? And that's obviously impacting on your psyche. So imagine that is going through the minds of everybody that you come into contact with, whether it's your suppliers, your staff, your clients. So what sort of empathy do we need to be building into our resilience models, in addition to the risk mitigation measures that we have traditionally taken? I'll stop there, possibly, and then take the next round of questions.
Thank you, Jackie. Raimond?
Yeah, thank you, Helen. Yes, just to be able to look at the situation around us and to be able to see how companies have actually been able to take up the risk and ensure that, yes, there is business continuity. So we've all been accustomed to the work from home arrangement. And even this week, it's actually getting to other levels. We've seen now even media stations, the radio stations, our TV stations, for actually the news anchors being able to broadcast to us the news from home. That's a risk that has been able to present itself. People have actually taken it, the challenge head on, and actually been, and it has been actualized. It's working. So the industries we thought working from home, that one is a no-no. But this COVID has actually taught us that, yes, we can be innovative and everything is possible. It's just an issue of us being able to give it a try. So the work from home arrangement, it's one of the areas that many companies, and I'll still urge that, yes, as leaders, as much as possible, COVID is going to be with us for a very long time. So let's be able to embrace it and ensure that as much of the employees as possible, we can actually be able to put them from a work from home arrangement. I come from bank environment, and banks are actually part of the essential service providers. So some of you may think now, yes, when you are been declared essential service provider, just like the medics, you actually have to report to your workstation. But I'll be able to let you know that actually 80% of the staff within banks actually working from home. Starting with the largest bank, KCB, 80% of the staff in actually KCB currently are working from home. And that's something that in January, February, you mentioned that within a banking environment, everybody will tell you we are such a highly sensitive environment. We cannot even think of that aspect of working from home. And then you'll also be told, yes, we have very sensitive network. We actually can't be able to trust people connecting with their devices outside our environment. So that's key. And as George has mentioned, yes, the IT risk, the data risk comes in, but now we just have to take the opportunity and be able to put in measures to ensure that, yes, all staff are aligned to be able to ensure that, yes, even as we work from home, we can actually be able to ensure that, yes, we are safe, our companies are safe, and we are actually not exposing ourselves to breaches and also not exposing our companies and our businesses to a lot of attacks. So I'll say that's an area that has worked well, and actually it has opportunities to be able to work well. And even as just a measure to be able to ensure that, yes, there's business continuity, the work from home arrangement works well in that at the moment we've seen, like even take a case of the Milimani courts that have now been closed for 14 days. So if 80% of staff within Milimani law courts are actually working from home, it would actually be a very big issue in that, yes, you will find within a space, we normally have 20 employees, but at each and every given time, 80% of them are working from home. So we have 2 or 3 who are actually on site just to be able to support those who are working from home. So when we have cases at workplaces where we have to close our environments, be able to fumigate and be able, and before we reopen, it will actually be affecting slightly fewer staff than when we go full board into reopening and everybody coming in. And then there is the simple aspect of social distance. Because in the workplace, you know, the challenge with workplace is that you are doing 8 hours within the same environment with your colleagues. And unfortunately, some of our environments, we operate in AC environments, and we're actually being told those air conditions environments are actually not good environments. They're actually very ripe environments to be able to spread COVID. So this aspect of spreading ourselves and to be as thin as possible on site and be able to ensure that people are working from all areas, it comes in very handy. Another challenge that people have taken on board within this COVID environment, and that's something that I really urge the leadership to be able to pick it up, it's also automation. In that we used to talk about automation, but all of a sudden, automation turns into reality, and actually things are moving. So mine is just to urge that we, as much as possible, drive towards eliminating paperwork as much as possible in all our workstations, in that, yes, we can be able to do everything. We conclude our agreements. We can be able to approve documentations online. So just to put in policies and the necessary measures to ensure that that is working and it's moving well. Even with COVID, there are people who are losing employment. There are people who are being hired virtually. So it's still an opportunity again, where now there are companies which have taken on board now new people. You actually done the advertisement, you go through the interviews, all of it online. You get recruited, we do orientation with you, all of it online. You meet all the teams, all your colleagues online, you start working, and it's still all virtual. So it's another opportunity where, and also the other plus on it is that the geography will not be able to be a barrier, in that you don't have to move from Mombasa to come to Nairobi for you to be able to work. I can recruit you. You'll keep being in Mombasa, but you'll do everything for me. in Nairobi here. So it's something that we just need to go broad, and we'll be able to get our much needed skills, because some of the skills are actually not so much available. So we actually may be able to utilize this aspect of virtual engagement, virtual working, remote working, to be able to assist. And then lastly, there have been new products in that the companies which have taken on board new products. You may think they're very simple products, but we have actually been importing these face masks, all the protective gear that you may think about, all the gloves, all these things have actually been being imported. But it's now an opportunity to be able to ensure that, yes, going forward at our individual company level, or even as government, to be able to ensure that, yes, there's some level of local production which you can be able to sustain our needs in that, because now we never know. And as the projections go, we may be in series of pandemics and calamities. So our global networks that we've been relying on, thinking that, yes, we are a global village, but when a pandemic hits, it becomes a challenge even to get a simple matchbox from China. So if we are not manufacturing matchboxes, then we may be in darkness. So we need to go that step further and just be able to take up the challenge and be able to manufacture some of these simple issues. And we've seen actually it's possible, because many companies actually converted from whatever they're doing into protective gear within a span of 1-2 weeks. And it's been working well, and they are able to, the market is there, both within Kenya and even the region. So thank you, I'll stop there.
Thank you. Actually, you've spoken to something that we are going to discuss a little bit later on, innovation and sustainability during a pandemic, in your last point there. George?
Thank you, Helen, again, and the team. I think change is the only constant thing that is constant. And we are seeing that we are going to have a lot of thought process and the change on how we take risk and our risk tolerance level in each and every company. As we talk about innovation and technology, I think one of the risks that all the companies need to start thinking about, and especially the leadership, is the cybercrime risk. With innovation, what we are doing and staying at home, we are going to have both ethical and unethical hackers having a field day. So we just want to ask leaders, how strong are you in this area? It's something that you need to really think about, because with all working at home, every change that we are making, social distancing and everything, we will be able to have this attack, and it is very important. We have to actually repackage as industry and as leadership what we call the credit risk. How do you now think about your credit risk? Are people able to pay you in time to be able to run your businesses at large? Are people struggling to pay you? What are you thinking about the finance team? How do we make it viable for them to continue trading with us and working with us within the accepted norms? Are we going to redefine what to write off at what particular time for the accounting? Think about that, because those are reality that we are having in the ground. Are we going to define what is a workplace and define, for instance, the insurance policies like WIBA? Because basically, under the Act, and the lawyers are here, it says it covers you from your house to workplace directly back home. Is that going to be feasible going forward? Food for thought. And a clear legal minds should be able to start thinking about that. And I think the judges should pronounce themselves very soon who are dealing with these issues. The other thing that we are looking at as we continue to social distance and actually carry our activities at home, are we really exposing our homes to a greater risks than normal? Or are they making the homes better? So these are the things in our industry we need to start thinking about, especially insurance industry. When everybody is now working at home, is there an overexposure? We have to look at how we write our domestic package, for instance. Are we really thinking how to write our public liability and personal liability insurances, for instance, because these are going to change given that we will not be really staying in the offices as much as we can. On the HR issues that we need to look at our risk tolerance. How then do you schedule working hours to your employees at home? Are you going to tell me I'm late at work because I was late for a webinar meeting which was started at 7, yet my employment letter says that you're working from 8 o'clock to 5 p.m. How are you going, as a matter of fact, to give a disciplinary letter out to show cause letter having been late for a meeting? Think about it. So things are changing. We are not going to be the
valid point.
Yes, normal is gone. It is now innovative and how things are going to be done. However, the underlying factor will be empathy and humanity. You must remain humane as leaders. Thank you.
Thank you, George, Jackie,
Helen, if I may,
yes,
just to touch on an issue that George has raised about data protection. There's the issue that George has raised around corporate data, but there's also the issue that is an emerging issue now arising from my personal data. So I've gone for a test and I've tested positive, and you now want to trace my contacts. So does contact tracing have any impact on my right to privacy, for example, or on the data that's in my phone about who I called, who I went to see, how long I saw that person? Are there any legal issues that are likely to arise from that? Again, those are things we have to think through, even as we talk about data protection and privacy. And even the testing, can I, as an employer, make you go for testing just so you can come to work? Is that the level we've been pushed to in terms of determining our workplace as a safe environment? So those are additional considerations regarding data. And even going a step further, do I have the right to ask you what your underlying medical condition could be in the bid to then provide treatment for you, or to enhance the cover that I have an existing medical policy? Do I have the right to ask you what those the proverbial comorbidities could be in order to then address you from a medical insurance perspective? Thank you.
Thank you. Now, that basically allows us to segue into workforce HR nuances. So some of those questions that I was going to ask under workforce HR nuances have been touched on by the three of you, but I want us to focus on something very fundamental, and the reason why we had to bring in George into this discussion. Now that you've just talked about data protection, corporate data and personal data, contact tracing, can an employer make me go for a test? We've seen a lot of mixed messaging coming from the regulator and underwriters on medical insurance in particular. And so I wanted us to focus a little bit on the impact of COVID-19 on the right to health and basically the right to proper, affordable medical attention. Because the fear that is out there now is that, and I say this as a result of the mixed messaging from both the regulator and the underwriters, is that God forbid that Helen Ambasa tests positive for COVID-19 and has to be admitted in hospital, I'll have to dip into my pocket, my personal savings, to be able to meet the costs for my treatment. Yet I have medical insurance, but there is the issue of pandemic exclusion, so I'm not able to get access to medical care. So I just want to hear from the three of you on, so how best, because organizations are also, at a loss. You've taken out medical insurance for your employees and suddenly it's almost as if it's not useful as long as they have COVID-19 or they test positive for COVID-19. So I want us to start a discussion on this, and perhaps we can start with you, George. We can change the order. We start with you, George, and then we'll move on to Jackie and then Raymond.
Thank you, Helen, for giving me privilege to delve on the issue of medical insurance.
Yes.
And I love it because I've had a chance to do this within the region and actually running a brokerage that we are doing this within the region. I think I will just start with a short introduction for our listeners and the viewers, wherever you are. Basically, I'll bring you home. Just let me do a summary of the world and bring you home, and probably unravel this thing called pandemic and how did it come about and why we are having problem with the insurance fraternity. On December 31st, 2019, Chinese health officials informed the World WHO, which is World Health Organization, about a group of 41 people in Yuan City who had a strange pneumonia-like disease. Not until January 7, 2020, was the virus identified as COVID. And on the January 1st, 2020, Chinese authority had to close the Yunnan seafood wholesale market and ban trade in live animals, as all wet markets and transportation of the same were also stopped. The first COVID-related was reported in China on the 11th January 2020, and on the 13th of the January 2020, the first case outside China was actually pronounced in Thailand in Asia. Our big brother, USA, on January 20th, the first case was reported in Washington, and currently, as you are aware, the country is one of the leading, both in death and the number of infection, waiting for India to overtake it, which may not be possible. The COVID-related deaths outside China was recorded in the Philippines, and then the Europe first COVID-19 death happened in France on 14th of February. And on the 11th, and this is very crucial date, on the 11th March, WHO declared COVID-19 a global pandemic. According to the Economic Commission for Africa, because many African economies were vulnerable, the effect of COVID-19 on employment in Africa was predicted to be quite severe. And we've seen this, our country being a good example in Kenya, but all the regional and other jurisdictions has all suffered the same consequences. A survey conducted in 28 African cities indicated that the low-income household ran out of food and money in less than a week after restriction of the movements were put in place. The Property and Environment Research Center report also note that although public health and social measures put in place will reduce transmission of COVID, healthcare systems in many African countries are still ill-prepared for this pandemic. Closer home to Kenya, we reported our first case on the 13th of March 2020, and as July 29th, which was yesterday, the caseload stood at 19,125 and confirmed infections, and 8,021 had recovered, and 311 deaths were also reported. And according to World Bank study, 4 out of 8 Kenyans lacks access to medical insurance because of poverty, which the rate stands at around 15% of this country, 56% of this country. And therefore, because also 75% of our population depend on the rain-fed agriculture, yet we are 80% arid and semi-arid, this makes it very, very difficult for people to be able to survive through this pandemic without recourse like medical and other social protection. And I quote, "Only those who are able to afford medical insurance have access to quality healthcare services." That is according to Mr. Kitulu of Kenya Medical Association. Closer to you leaders, Section 34 of the Employment Act 2007 call for sufficient and proper medicine for employees, and if possible, medical attendance during serious illness while working. The employed and low-earning self-employed Kenya are therefore at the mercy of COVID unless the situation changes. And this brings me closer home to what many of us have been asking. How do the insurance companies and the insurers who insure the insurance company in Kenya and regionally define what is pandemic? And I think I just want to give our listeners and the viewers a small definition of exclusion that the insurers may have put in your policy or how they are defining it. An epidemic is the rapid spread of infectious disease to a large number of persons in a given population within a short period of time. And the word is infectious disease, which affect a large persons in a given population within a short period of time. So it's also time bound. An epidemic may be restricted to one location. However, and this is very important, if it spreads to other countries or continents and affects a substantial number of people, it may be termed as a pandemic. And this is what happened. A pandemic is an epidemic occurring on a scale which crosses international boundaries and usually affects a large number of people. Now that you know, and now that I know, that this pandemic was announced with WHO in 11th of March to be a pandemic, therefore, a few policies which had the cover continue to cover, but those policies that had this exclusion, they were called upon to be able to come into place. And therefore, when you go to your insurer, they are telling you there is no cover because of that exclusion that were put by the insurance companies, and therefore the insurance fraternity also followed it. However, it's rightly to say that this exclusion may not appear in your policy document. And therefore you have a right to ask your medical insurer or life insurer or any other line of business to make good their promise to pay you. So there is hope, ladies and gentlemen. A deep analysis of the policies in the market is important that is done. Therefore, for you to find out if your cover exclude pandemic or not. This need to be done with qualified guys who have enough experience to help you to decipher this before the insurance company tells you that there is no cover. Therefore, in view of the foregoing, each insurance policy that has given to you as leaders and under your possession should be clearly looked at and construed carefully with the people of knowledge to show you if there's an exclusion or not. For instance, the life policies majorly did not exclude pandemic. And as a result, so long as there are no exclusion, you are able to get your life policy operating full throttle and making good for the promises of your investment that you put in. We also need to note that initially in our country, when we come back to Kenya, the doctors initially were on your death certificates, were not indicating the COVID-19 as the proximate cause of death. And therefore, we believe so long as that is not input in the death certificate, therefore, you have not to worry. Your policy never excluded that. And if it did exclude and the other cause was actually not COVID, then the covers are there. So it's also important to know that the legal construction as per the cause of death that will be followed by each and every insurance company, and they are doing it already. And the government, through the regulator, is also asking the insurance companies to critically look at the policies and see if the coverage is there, which majority in Kenya will say are, and be able to cover that. We are also seeing of late that the government is asking now the medics to be able to include the cause of death, that if you die of COVID, then it should be included as the COVID-related cases. Initially, they were simply saying pneumonia, that the cause of death is pneumonia, and that you will see in several death certificates. So if it is pneumonia, it's not excluded. So fine, we're okay. So we are saying that the regulator has also come strongly to state that COVID pandemic should be covered, and I say should be covered. However, as you are aware, that all the policies operating in the market are actually licensed and approved by the regulator. So for those that he has approved and there is no pandemic coverage, he cannot force the insurance companies to cover them. What then remains to the populace is for us to probably have a relationship discussion with our insurers and have cover that are called payment that are called ex gratia payment, which means I will be paying you though the liability does not attach. And this will be handled case by case. And normally, more often than not, they get approval from their insurers also to cover that. Just to wind up this so that we'll move to the other sector, what therefore is the reality on the ground today? If I walk in the hospital, what am I faced with? One, the insurers and the medical, where there is no, will allow you to go for the medical tests. And in the event that the tests indicate that you have COVID, they've been paying all the costs up to when the COVID test is done. And if the policy excludes COVID, then other costs are now left for you to cover. So long
from your
as,
pocket.
From your pocket. COVID-19 is the proximate cause. Then they stop payment at that level. Is it fair for us or not? That's a point that we'll be discussing, and we'll be able to see the way forward. So the other thing is that we've also realized that some insurance company, though they have the coverage, they have been asking their policy holder where the pandemic is not excluded to actually go to the government hospitals to help them with the cost management strategy. So they're simply saying, no one knew this pandemic will affect the world to this extent. So our actuarial teams and the insurance people never rated COVID-19 magnitude effect. So the modeling that were done did not take care of these large pandemic things. If we go back, we were told that one of the major pandemic was the Spain pandemic, which probably the number is 500,000 or thereabout. I don't want to state the exact number. Basically, that was the largest that we've seen. But if we see what we are going through now, is one that nobody hoped about. So what are the insurance people doing that we need to be careful? That as we manage our cost strategy, we should not deny the public whose policies have no exclusions to be denied coverage. Now, how then do we do these costs? The cost management should be a discussion that we need a direction probably from the insurance fraternity and the regulator so that the members of the public still get treatment, even if it's mean the best government hospitals. As we said before, the life covers where there are no exclusion of pandemic, I think we are good to go. And the insurance fraternity should be able to make good their promise. And we are simply saying, lastly, we expect a lot of claims coming in the next 1 month when the Kenya reaches its peak. And that's where the rubber will meet the road. It's not yet known. And that's where our bread will be buttered. And we know who actually is a strong insurance company. This number, as is escalated and towards the peak, is where that we'll be able to see a lot of legal discussion. What do we do? Having said that, we've had discussion with the insurers and the insurance companies, and what is being agreeable, that they'll be able to be empathetic and look at the policy case by case and what was drafted. So ladies and gentlemen, it is not all blink. there is hope at the end of the tunnel. Helen, let me stop there as we'll be continue to what now are we currently thinking to do?
Thank you, George. Unfortunately, I don't agree with you that there is hope. It looks so bleak. I've seen a lot of peddling of fear. And frankly, if you ask me, I don't think the regulator has really offered leadership on this particular issue. So, but we'll delve into that at some point during this discussion. Over to you, Jackie, your thoughts?
Okay, Helen, I don't think the light is that of an oncoming train. I think there is hope.
Yes.
And I want to be very careful with what I'm about to say. I took my own advice after our last webinar and I spoke to our broker. And it is clear that in the market, there are some underwriters that are covering COVID-19 and have indeed created COVID-19 packages, whether as a standalone or as a rider to your existing medical policy, or even by way of ex gratia claims. However, they are only offering this to their existing clients, insured, because they have a history with those insured. They know what the scheme has been operating like, or what at an individual level, what your claims history has been like. So to that extent, there is certainly hope. Now, as George has mentioned, obviously the big consideration for the underwriters has been around the cost. Now, if I have to test my staff, for example, Helen, and the cost of a test is 10,000 minimum per staff. And imagine if you're in an industry like the hospitality industry, where I'm being told to test them every so often, or in the logistics industry, those who provide long haul transport, you're being told to test your staff on a bi-weekly, I mean, every fortnight.
Every 2 weeks, yeah.
How is it practical that you are going to continue as an underwriter to cover that? Or even as the employer, how is it practical for you to be expected to meet that cost? Especially because on the other side, you're not at your peak business level. You are operating at a severe deficit in terms of your capacity to continue to deliver goods or services, or even to access markets. So we need to be realistic. I think the government, I know we always say Serikali's idea, but here we need some direction in terms of the cost of the testing first and foremost, because the testing is the beginning of everything. Once we know your status, then we know how to treat you. Even the medics have said this. They know how to then even extrapolate in terms of how the disease is peaking, when it is likely to peak, because apparently, guess what? We are all supposed to get this disease, apparently. So that's what flattening the curve is all about, isn't it? So are we then saying that, is it practical to expect this costing of tests to continue? And the answer is no. And then, are they even available? The last, I think 2 weeks ago, when the CS for Health was speaking, he was saying that for reasons of bed capacity, Mbagathi was no longer available for testing. So if you wanted a test, you should go to Kenyatta. Now, even at Kenyatta, I think the cost was something like 5,000. Is that something that we can afford? Given what we have been through in the last 4 months, who can afford to go for testing? And unfortunately, the government inadvertently created a stigma around testing at the beginning of this pandemic, because of the way people who were in quarantine were being treated, the way that people who were testing positive were being, you remember the CIA case, the guy who was buried under cover of darkness in a very inhuman way. So the stigma then started to develop in people's minds. So a lot of people are reluctant even to get tested as a starting point. Once you get tested, how long do you have to wait for your results? And what is the anxiety that builds around you as you wait for that test? Again, psychosocial support. Meanwhile, you're not getting that psychosocial support. And what sort of exposure then for other consequences in terms of the things George had mentioned at the beginning: domestic violence, gender-based violence, child neglect, child abuse, all those other things that are happening in the home as a result of all the anxieties we already have, in addition to the COVID-19 specific anxiety. So then there's the tracing. The other day, there was a gentleman on a television panel. He was talking about his experience having tested positive. He's a legal scholar. I believe he's studying legal epidemiology at PhD level. He happens to be married to a doctor. So thankfully for him, when he started feeling overwhelmed by his symptoms, and at that point, they didn't even know he was COVID-19 positive. His wife then took very immediate measures to contain his fever and other symptoms that he was exhibiting. They called an ambulance. The ambulance said, yeah, we can come, but we don't have anywhere to take you because we have no beds. I think Raimond had mentioned earlier that we have been told there's no bed capacity in Nairobi. So even with your insurance and with your access to an ambulance, you have nowhere to go to access treatment. And we're always told, if you're not very serious, in fact, just call your doctor. Don't go to the hospital. Just call your doctor. So anyway, he then managed to access his doctor, I think the following day, and he started a course of treatment with that doctor. And my question then was, those of us who are not married to doctors, what happens to us if we get these symptoms in the middle of the night? If our symptoms are so overwhelming as to render us incapable of accessing medical services? So when people talk about peaking, is this what peaking means? Is this what it means to say that there are those who are asymptomatic, the proverbial mosquitoes, whose job is just to transmit the virus? And then there are those of us of a certain age who will present symptoms. There are those because based on our immunity, we will present the symptoms in a not very serious way. There are others because of underlying issues who will present in a more serious way. So even as we talk about insurance, there's a dichotomy to the insured. We are not all homogeneous COVID positive 19 patients. We will all present in different ways and we will all be treated in different ways. So I can understand the industry's reticence in terms of response. So it may not be that they didn't want to respond, it may be that they also didn't know how to respond. Now, with the history that George has given us and the projections that they are now seeing from the actuaries and everything, as I've said, I know there are underwriters in this market who are offering cover. So each and every one of us needs to be talking to people like George, our agents, our brokers, or directly to the underwriters and finding out what is available to us. NHIF has said, I think last Friday, we will not abandon you, even if it's a pandemic. However, you must go to a government facility. Now, in reality, are those government facilities accessible from a treatment perspective and from a general perspective? Because people have also been told, don't come to Nairobi. At county level, are people ready? I can tell you frankly, in my home county, Siaya, and in my county of marriage, Kirinyaga, those are the worst two counties in terms of preparedness for COVID-19. So me personally, Jacqueline Oyogibinde, I'm stuck. I can't access beds in Nairobi. I can't go to Siaya.
Can you go to Kirinyaga?
That's on a light touch, but for a very heavy issue, because these are the issues that are facing us on a daily basis. If I was to contract the virus, where do I go? I may even have the insurance, but will I have access? Whether it's the ambulance that can take me there, or once I get there, what kind of medical care and attention I will receive. Also the health industry, the health services industry, they're also now beginning to see a spike in the number of healthcare professionals that are succumbing to the virus, whether just by testing positive or also now in terms of fatalities. And people are only talking about, and may she rest in peace, the doctor that passed away. But we also heard, especially from the staff at Pumwani, there are clinical officers that have been affected. There are nurses that have been affected. There are other staff within the facility that are being affected. So even if you make it to the facility, what are we talking about in terms of the health care and treatment that you are going to receive? So it's one thing, as George has said, to have the insurance and to be able to push for the cover and to get the cover. That's what we call preparedness. But there's the other aspect of when you actually access the facility, what kind of care are we likely to get? Thank you.
Thank you, Jackie. I have a question. Before Raimond responds, I have a question for, both you and George. So in essence, how do I put this without sounding very excited that you will reopen in January because of the impact on the financial revenue side. It's probably not the right time then to be talking about going back to work, as it were, the old way, where we are meeting each other in the office, and because there are all these things that you need to think about now. If these employees, or God forbid, in the situation of a school or university or college for that matter, if they are to get infected, there's no space in the hospitals where they would be accommodated. So probably it's for the best that we continue to work from home. I know it's going to be something that we'll discuss under sustainability and what you see as the future when we are talking about workforce HR nuances. So just putting it out there, is that a valid conclusion to come to, or am I again jumping the gun? Because I'm just looking at what you've said, and how the situation looks so bleak in terms of facilities that are available to come to my aid if I was to test COVID-19 positive, and then it's a situation where home-based care would not really work in my case. Yeah.
I think, Helen, if I could go first, I think it's very imperative for us to know a pandemic, as we've defined it, something which is a large scale, is affecting the entire world, and there are no proper data that will be able to help you with your financial aspect that you have as an insurance company to be able to make payment for all that. One of the issues that we need to do is that the insurance company can only help you to mitigate of certain costs. We know currently, even as we discussed, the cost of testing will be limited. The cost of covering COVID will be limited. It may not, it's like the pre-existing conditions and chronics under your medical, where though you have a total limit of X amount, it's limited to a certain amount only. So it will not be paid in full. So it will be able to be within the chronic, it will be within the limits that will be capped. But it's totally different on definition of the power of the chronics, because the chronics are defined like the disease that has no cure for a prolonged time. But we know even now, do we have cure for COVID? We don't know. There is no cure currently. So maybe that's where it might feel, and it will still be sublimited. So therefore, when it comes to pandemic, when WHO announced this, is whereby we are saying, what does your government do to prepare to be able to alleviate the health situation of your country? And that's why some of the donors have even given our government a lot of loans and a lot of grants in order to prepare. And even the government has put some of the tax that we've earned to prepare for this, because it cannot be handled by the insurance mechanism alone. And I like what Jackie was bringing up. Even if you are to bring everything and there is no facility, even if you have insurance cover, but we don't have facility, where will we go? So what then is the role of a nation's, the government? I think this is where the government policy comes in. And I think we need to learn from the people who have fought it well, be it in Europe, be it in Africa, so that we are prepared in such a way that if he says 300 beds, is not 80 beds plus the double decker, or plus that bed that will not really be able to help us. So we are saying the government health policy and integrity should be such that our leaders will be able to transfer some of our budgets to the healthcare management to be able to help the nation to fight this. And again, we are simply saying, what's then the responsibility for us as Kenya? Health protocols that we've been told by the Minister of Health, are we really implementing them? So we also have a role. If the event that we do what we are being told by my friend Mutai Kagwe every day and the team, then we'll be able to manage this situation. And this is not only for the populace alone, even our leaders. Our leaders should be men and women full of integrity, whereby when they're saying it's 300 beds, it's actually 300 beds. If they're saying that we want to scale this to 500 beds, it's not 250, but it's 500 beds. So, and then what's our role as populace? We need to question what the leaders are telling us on the healthcare management. Are they really reporting what is there on the ground? And I think we have a role to be able to see that if all of us work together with the government, the policymakers, the insurance fraternity, NHIF, all the organizations we're involved, we can do better than what we're doing currently. So it's our role to ensure that that leadership, that is servanthood leadership, the leadership of integrity, the leaders who are pure in heart and not in word, rule this nation. Thank you.
Thank you, George. So you basically touched on the issue of how data, metrics, and culture can drive forward strategy through uncertain times. Jackie?
I think in addition to what George has said, I go back to a comment I made at the very beginning. Are we as a nation approaching COVID as a public health issue, or are we approaching it as a security issue? Because if we are approaching it as a security issue, then we have lost the plot. If we are approaching it as a public health issue, then we are addressing all the issues George has just raised when he spoke a minute ago, in terms of the integrity of our leaders to address the situation from a real perspective, in terms and not just bed capacity, but are there beds that are available? Are there medical personnel who are available? If you have a ventilator but you don't have the personnel to attend to utilize that ventilator, then technically you don't have a ventilator because nobody can use it. If it's the funds that have been allocated to the containment measures and to the treatment measures, are they being properly utilized, and are they being properly accounted for in the manner in which it is intended? So even as we police behavior, because that's one aspect of it, and yes, it's true that a lot of us have to take, every one of us has to take personal ownership, are we also policing the behavior of the state agencies that are tasked with delivering public health to every single one of us?
Thank you. Raimond?
Yes, thank you, Helen. Yes, briefly, just on this aspect, I'll tend to agree largely with Jackie, but be able to, in a way, tell George that the reality on the ground is quite different from the assurances that are actually being given by IRA, because IRA has actually been in the public domain, because actually they were making a presentation before the parliamentary committee where they were really coming out strongly and saying if it's treatment in a private hospital, no insurance is going to cover. You only cover for COVID treatments that are actually done at public hospitals. So from that statement, we've not had any other communication from IRA bringing in the angle where you're saying, yes, there are covers where it's not expressly excluded. You can actually be able to have cover. So that's the challenge. So for me, to the leadership and to all of us, the key thing is you need a commitment in writing from your insurance provider that yes, they're actually going ahead to be able to cover COVID-related ailments. Without that written commitment, because I know from the banking industry where I work, yes, there are some banks which were aggressive enough, and they were actually able to get those commitments in the first week of the first case being reported in Kenya. Because, you know, at that time it was still PR, so the insurance was still willing to be able actually to commit in writing that yes, but currently now I know it becomes very difficult conversation with the insurance even to commit in writing. So there are some companies which are proactive. So if you haven't still currently now, you can be able to recheck your policy. If it doesn't expressly exclude pandemic, it's something that actually you need to take it up, and which actually may also involve litigation. If they say no and in the contract it's clear, as George has said, it's not excluded. It's actually something you can actually be able to litigate upon and actually be able to get a determination. And I know being COVID, even if you go to court under certificate of urgency, it's something that the court will also address as a matter of urgency and be able to give some orders on that. So that's key. Now, for us who it's expressly excluded, pandemics are expressly excluded in our covers, what we need to do now is to go an extra mile, just the way Jackie has said, in that insurance companies are still covering COVID, even in that particular environment. But the only thing is you will have to add some extra premium so that it will be a cover which is actually attached to a primary cover. And then now, as also it has been explained by George, it will not be open-ended. So if you have an inpatient of, let's say, 5 million or 3 million, COVID, even if you are an inpatient patient, it will not cover up to 3 million or the 5 million that's in the cover. It will be capped somewhere at maybe say 500 or 1 million, because they're also looking at it, and because it's a risk which they know definitely from your population, 1 or 2 people may actually get to that serious level that they need serious. They'll be in serious condition that they need actually prolonged medication. So it's very important. If you don't get commitment, please go a step further and be able to negotiate, because it's just some slight, it may be 5, 10, or 15% of your original premium now, just to be able to cover for COVID, which will come in handy. And as we are talking in that, you really need to look at the human aspect and the people issues, because if your staff actually know that, yes, my employer has gone a step further and actually been able to provide some relief for COVID. So even when the person is working from home, there's that semblance of assurance in that, yes, at least my employer is still working with me, despite the fact that we are working remotely, and it will increase productivity in that there's some sense of the worker is actually, there's actually some peace of mind in that the worker knows, yes, there's a likelihood I may be able to get COVID. Now, there's also a likelihood that I may be in the 20% who will exhibit symptoms, or there's a likelihood I may be in the 5% who may be very serious and actually need hospitalization. So I'll be working, but knowing at least there's some cover, and then my production will actually be at an improved level as compared to an angle where I'm worried. If I cough, if I sneeze, I have to look at my savings. Or if I have no savings, then now I get into panic mode as to now, how am I going to manage this? And it may not, and it's just a disease which may not be limited to me alone. It may extend to the people around me. So now we get these fears again that, yes, one patient in a private hospital, you start counting of 1 million and above. So just that thinking alone will actually make somebody to not be productive. So you may actually start having difficult conversation with your staff that, why are you not being productive? Why are you not efficient? Why are you not accomplishing your tasks? But actually, this person, other than the mental aspect, it's just that it's a COVID situation, and the person just worried that if this happens, how am I going to sort out this? So it's key for leaders to be able to do that, have this conversation. And it's an issue of just having conversation, and also the covers are flexible. You may go for a cover of inpatient of 500. And the beauty is insurance is actually just an assurance. You may find out that actually out of your population of 100 people, 500 people, yes, 10 will get COVID, but they'll be asymptomatic, or actually they'll only have mild symptoms. So even they'll not even require to actually use, they'll in fact actually use the primary cover, because when they go to hospital, they'll be told, yes, this is flu. Or like for me, last week I went to hospital and I was told, you are having a bacterial infection. So, and the symptoms are the same like COVID, but the doctor tells you have bacterial infection. So you're given antibiotics, then now you go through the session and you get well. So some of us, we're being treated of COVID, but we never know. We're actually getting medication for some other things, but actually it's COVID. But that level of assurance, it keeps you going, not worried. People around you are not worried, and then life moves on. And then there's also the other aspect still on insurance on home-based care, because we've seen in the recent past very huge numbers being reported as having recovered. And the right again there is that yes, out of these recoveries, 80%, 95% actually from home-based care arrangements. So as leaders, that's also something that we really need to look at. You as a leader, I know, yes, you are in a house where, yes, you can actually be able to make that room to have someone isolated. But 80% of your workers are living in environments where they actually can't be able to have that extra room to be able to isolate themselves and be able to take care. So in fact, it adds, because like, as long as isolation comes in, it is not home-based, it's outside, it's actually the expenses coming, and very huge expenses, because on a daily basis, you have, even if you are asymptomatic, even if you have mild, there's daily care, bed charges that you have to pay. So we have to look at that angle and be a bit practical as to how can we assist our employees to be able to have a hybrid of home-based care. So what some of us are thinking, and even in the banking environment, is you may look at companies within your locality. So you have 4, 5, 10 companies within a particular locality. Can you be able to identify a facility? And nowadays, like they actually, and even now that the colleges and the universities have been pushed to January, can you identify an institution where, yes, you have your workers who have tested positive, but now they have no capacity, actually they are symptomatic, or they are very mild symptoms. They are actually candidates for home-based care, but they have no space within their living area to be able to have that arrangement. So you find a common facility just to be able to hold the staff for 10 days, 14 days, and then I'll be able to release them. So it will really go a long way to be able to still bring the costs down, because this person will not be able to be admitted in a hospital, but it's just a facility where now they are taken care of. And also we have the community volunteers who will be able to check on them. If they develop serious issues, then now they move from that facility to the hospital. But a majority of them, as it's being reported, they'll be in that facility for the 10, 15 days, and then they'll be out. So that's something that actually can be able to implement for mostly the 80% of our staff who don't have extra rooms within their living areas to be able to self-isolate when tested positive and they're not showing any symptoms, or they have very mild symptoms. So it will go a long way to actually, and it will also help just on the psychological aspect here, because there are some of us, that hospital environment, it will make you much more sick than even when you went there. But if you are in another different environment, your ability to cope will be much more higher than now being in hospital. Thank you.
Thank you, Raimond, Jackie, and George. As we get to almost winding up, I just want to send out a call to the participants. Please submit any questions you may have through the Q&A. I know we disabled the chat, but you can submit questions through the Q&A. So there's one question which I thought would be best answered as we discuss, what I like to call workforce HR nuances. So somebody wants to know what measures need to be put in place for continued service delivery. And as we respond to this question, I'd like to hear from each one of you. It might sound repetitive, but so what are the COVID-19 lessons from a governance and risk management perspective as we go forward? Because remember, when we started, we said that even though the theme is still leadership or leading in uncertain times, governance, legal, and HR issues that organizations have to contend with, today the focus was mostly on, proactive risk management and for purposes of recovery and resilience. Yes. So we start off in the same order: Jackie, Raimond, George.
Okay, so there's two questions there. Firstly, the question that the participant has asked about how do we ensure continued service delivery, and then the question you have asked around the proactive risk management. So in terms of the participant's question, I think I'll just direct you to the directive that was issued by the Directorate of Occupational Safety and Health. I think it was on the 29th of June, about return to work advisory. So it's called a return to work advisory, but when I read it, it presumed that we had stopped working, when in reality, there are people who are still trying to work from home.
Mm-hmm.
Now, inbuilt in that advisory, there are several steps that the Directorate is recommending. Firstly, that we assess our risk for COVID-19. So issues like what Raimond was mentioning earlier about what does your physical space look like? And does it allow for physical distancing of at least 1.5 meters between your workforce? And then all the other measures in terms of providing the protective equipment like the masks, the sanitizer, making sure that you're wiping down your surfaces and things like that. So very practical suggestions. It also talks about non-essential workers working from home, which is misleading because it's not necessarily your non-essential people who will be working
Mm-hmm.
from home.
Mm-hmm.
It is those people who you as the employer can enable to work from home, which is what we mentioned even with our last webinar about, do you first of all have the financial capacity as an employer to enable your people to work from home in terms of the devices they may need, in terms of both from a hardware, software perspective, and also the data that they need access to. And we've talked about
Mm-hmm.
it a lot during this webinar. And then their commute back and forth. What does that protection look like? The directive talks about where possible employers considering providing a safe commute. Again, is it practical with everything else that employers are having to deal with? Is it practical to recommend that employers, and some may have, the facilities, they may have staff buses and things like that, but for those who don't, then you're really relying on public transport or private transport. Those are the only options that are available. And then the workplace safety and health, the insurance that George has mentioned in terms of WIBA and also medical. So in terms of service delivery specifically, it's really asking yourself a question as an employer: can you still enable your people to work whether from the office or from home through your own financial capacity? It's a question you have to keep asking yourself, and it's a question you have to keep addressing as we continue. We've been told this pandemic, yesterday I watched something rather disturbing that even if we're to find a vaccine, then we don't know the veracity of that vaccine. We don't know how long it will take to reach us here in Africa, because we're always the last, even in terms of COVID infection. But very practical questions around how long, as an employer, can you continue to provide these facilities, and where do you do the cost-benefit analysis? And unfortunately, also then when do you start having to let go of staff where you are not capable, because your strategy has obviously drifted, your market has shifted. If you are not able to take advantage of the opportunities that Raimond had mentioned earlier, if you're not providing solutions other than what you are used to providing, then are you still a viable entity, and can you continue? Or there is another opportunity. You may be right for acquisition or merger. Those are other considerations that you may need to start thinking through your continued viability and sustainability as an organization. So Helen, I think I've answered the first question in terms of the Directorate directive. And as to your question, it's really around your continued resilience. And if you're not able to be resilient on your own, are there other considerations? But again, like I mentioned at the beginning, this is also where your leadership comes in, your leadership team, and specifically your most senior, your topmost, your board. Where can they unlock doors for you? If it's an industry conversation, can the banking industry, for example, have a conversation with the insurance industry? Can the real estate industry have a conversation with people who are lobbying on behalf of tenants. You know, this is like the Titanic, we are all going to sink. So to avoid us all sinking, where can we empathize with each other and come up with solutions that are a win-win for everybody? Because nobody is going to benefit. I think probably other than certain industries that have thrived, like the internet solution providers, those are people who are not feeling, the pinch that perhaps other sectors are feeling. So how do we partner with each other to come to some sort of win-win situations that then mean we don't all sink with the Titanic, so to speak? Thank you.
Thank you, Jackie. Raimond?
Yeah, thank you, Helen. For me, on the aspect of continuity, I'll be able to look at it and be able to say, yes, COVID has actually taught us to come back to the basics, be able to be calm, and also try to be simple. And simplicity in the fact that you evaluate your business on the aspect of what's really critical to be able to continue with. And that aspect of analyzing that criticality will be exactly what is selling and what's going to continue selling into the future, whether you are selling a good or whether you are offering a service. So that's key. Like for the universities, I know Trump has said, hey, I don't want foreigners. They can actually be able to do the learning from their home countries. We'll be able to offer online learning. So that's a shift in that even locally, I know, yes, there are parents who will think twice and be able to really be hesitant to send their children to universities. So people will be comfortable having their children around, but being able to learn virtually. So it's a shift in that businesses can still be able to evaluate and be able to say, yes, can we be able to automate and be able to actually be able to go full scale on virtual learning? Yes, I know our very own USIU, you have all sorts of nationalities. It will be a challenge to still have all those nationalities comfortably coming to Kenya, or people comfortably taking planes to be able to move around. So can we be able to put in measures to be able to ensure that, yes, we go full scale on virtual learning, and then now we do the blend. So that's key of just being simple, being calm, and looking at the situation and how long. Because even if we are saying we are opening in January for face-to-face, but it will be slow, and then you may not get the numbers the way you had projected. So as a university, you may not grow. But if you go full scale on virtual learning, and then I'll blend it with the face-to-face, you'll get that, yes, the face-to-face, it remains flat or drops, but the virtual now, you have the whole world to be able to move forward. So that's one key aspect for continuity and just be able to take advantage of the situation. So for that, you will realize that, yes, there'll be savings, there'll be investments into it, but the business will continue growing. So it's key to be able to see how do we bridge. COVID has come, the bridge was broken, but we still need to move people across. Do we need the same bridge, or can we fly people across, or can people swim through the river? So we, as leaders, we need to look at those options on how to be able to fix that channel to be able to ensure that, yes, people are still crossing, but how are they crossing? So it's very key to look at how to bridge that for future. So we look at ourselves together with our customers, because we may really look internally and forget about our customers. If our customers have moved, and when we return the old bridge, our customers are not willing to be able to, yeah, they're actually looking for other means to be able to cross, but going to the same side, but using other means to be able to cross. Then the other key thing is just breaking this barrier of, because initially we used to have this conversation of home-life balance, where now you're working, and then now, hey, come to 5, you need to wind up and you need to be home early. And then weekend, we encourage our people as much as possible to be able to be with our families. But now this barrier has been broken. So we just need to look at and be able to engage with our staff, be able to, because it's just an issue of conversation. As a leader, when you talk to your staff and be able to give them insights and the advantages of that environment that has been provided, in that you are more with your family, you are closer to your loved ones. So there's a lot of positives, and those positives may actually be taken for granted unless somebody reminds you that yes, you should not just take, it's an opportunity that you should not just take for granted, but you actually need to capitalize on it. In that this barrier of you are really at crossroads as to how to do the home and work-life balance, but that barrier has been broken. So can you be able to take advantage of it? It's key, and it will go a long way in just ensuring that yes, people are productive and people are also embracing the work culture. And the other aspect is just as leaders and also as colleagues, it's just an issue of reaching out to our fellow colleagues, because we've moved from that space where you have to see each other physically, but that doesn't mean that we only connect during formal meetings. Let's reach out, find out how your colleague is faring on, physically, mentally, emotionally, how they're going on, what's going on through their life, what's happening to the extended families, because yes, people will lose their mother-in-laws, people will lose their cousins. So you may not get to hear it, but when you call the person may get to know about it, and you may have some conversations, because there are some who may lose mother-in-law, there are some who may lose grandparents. It may really affect them, different from what you as a person may think. So it's just an encouragement that yes, that conversation needs to continue, and there is a need to reach out to the people we work with to be able to ensure that yes, we are still connecting and as people, even though the fact that physically we can't be able to meet. Then lastly, what I'll be able to say is as companies also, there's a lot of investment into working from home arrangements. So people will need chairs to be able to use to do their work. So the chairs that are within our home environment may actually not be conducive to be able to do the work. And even some of us, we may have backs that actually need orthopedic chairs. So as leaders, as supervisors, let's have those conversations with our staff and be able to even extend, the Employment Act provides for employers to be able to extend loans to their staff to a maximum of 2 months salary. Then now you can be able to recover slowly, because it's an investment the staff is investing in. It will be an asset for the staff, but yes, it will be used for work. And even if he moves on to other things, he'll still have the asset. So what you can do, the staff doesn't have money and he has no budget for that. So as employers, you can be able to have that arrangement, be able to give funds to your staff to be able to put that infrastructure in place. Things like internet, yes, you may not go full throttle to be able to install internet to your staff homes, but you can actually be able to, yes, be able to extend some loan so that the staff can actually be able to put the infrastructure in place. Then now on a monthly basis, you can look at, yes, what allowance can be able to be given just to facilitate that. So that will go a long, long way in just ensuring that, yes, people are productive and people get connected to you and you don't lose your employees. Because the surprise might be, you may think you still have employees, when in reality, when you get back to normal and you want all your employees, some will tell you, hey, we've moved on. Because, this work from home arrangement, some people may be doing 3, 4, 5 jobs at a go. Mm-hmm. So you as an employer, when now you require them, hey, come back to my situation, come back to your desk, somebody will tell you, bye-bye, I don't need your desk. I'll continue with my other 2 jobs that I have. So for you to keep that employee and for that employee to make that decision to still come back to your desk after having this opportunity of touching other things, there'll be the small things that you've extended and made his or her life comfortable to be able to deliver for you. So you may look at that angle of, yes, extending some small credit to be able to get small items. They look minor, very minor, but they are very key and they go a long way, both for production and even the health of the staff. And also some of these things are actually regulatory, because like in an office setting, if the staff tells you, yes, I have a back problem, you have to get an orthopedic chair. So at home, I still need that particular chair to be able to work well. So as an employee, you still have a duty to do that. As George said, yes, there is waiver, which now just used to cover work environment, or when you are in the matatu to and from work. But now I'm in my house. So yes, so it's a conversation that we need to have with the insurance to be able to ensure that, yes, within this particular period, people are working from home. WIB actually also needs to extend to that level, and including the occupational health and safety aspects. Thank you.
Thank you, Raimond. George?
Thank you, Helen. I think I would start by saying and to echo what my colleagues have said, and I'll just add a few things for the sake of time. I think this time is the time that the leadership we call for emotional intelligence leadership content to be at its peak level. We are talking of self-awareness, self-regulation, motivation, empathy, and social skills. As leaders, I think it's the time to embrace these skills that we've been taught severally in order to manage at this time of COVID-19 pandemic. Because at the end of the day, you are not seeing the guys. You don't know where they are. How then do I become aware of my leadership to be able to lead the team that more often than not are not even in contact with me? Very, very critical. Your self-regulation as a leader, do you boast on them and simply saying, I am the leader? Do I really regulate my emotion where I'm doing things to ensure that I go to the quadrant of motivating everybody, and therefore the staff also become self-motivated to work for the organization? This is the time for the empathy in the entire industry, be it from the government, give it from the company, be it for us with our fellow colleagues, be it for the bank fraternity being empathy for the peoples and the loans that are required. It is the time that we need to preach this to the the highest peak of maybe Mount Kilimanjaro. It is the time to develop our social skills. How do we then interact with people? How do we bring people together that despite of the fact we are not seeing them, we are still able to inspire them to grow this magnificent organization for the future generation? Let me say a few things that I believe in as a leader. I believe that every staff are divided in the 5 components, which are very, very important. 1, the spiritual man or woman is very, very important. Secondly, social man or woman is very, very important. Physical man or woman, we cannot forget. Family man, but we live in this context. And then the last thing that I will bring to the table, if the four components are stronger, we are going to have a great leader, a great worker, a great nation. What do I mean by spiritual man? More often than not, at this time, we don't even think of the spirituality of the people that we are working with. Are they still nourished to be able to stand the ethics and the ethos of life? How are we supporting them as an organization? The social man that Raimond has also alluded to, do we still keep our social relationship as intact? And do we know what our people are going through at home? You may assume they have money at home, but because the children are in the house, they've eaten everything. How do we help them as an organization and encourage them to continue? Thirdly, the physical man. Do we emphasize our physical fitness? Today I've done 13.7 kilometers in the morning. How many of us are helping people to be still strong enough to be able to continue going? Yesterday I also did 13.5, so Helen is an habit now. So I'm going to 15 and 21. But we're saying we need to remain physically healthy to be able to deliver the mandate that are given to us. How is the organization helping us to do this as an employee? I am a leader in my company. What am I doing to ensure that people still are healthy and stronger? The doctor tells us that your physical, mental condition is very, very essential to fight COVID. Are we just throwing them out, Mr. Raimond, as a HR practitioner? This time, people have even forgotten the development of the career. So the fifth man is the working man, the career man, the professional. Are we still developing them at home? Or that lower cadre that cannot go to a training has been pushed aside to develop their own strength and capability? Are we training them to deliver the first class services that they are requiring them to deliver? What are we doing? Those are questions that we must, as leaders, continue to ponder in our mind to make the great working place to be achieved. As per the processes, it will differ. It's going to vary. So that I will not deliver to you. You will be able to look at it as the ESCO of the company and say, how do we achieve this total man, spiritual man, social man, physical man, family man, and lastly, the career man.
Thank you, George. And on that note, before we conclude, there is a burning question. One, I think, Raimond, you can take that. It's a carryover from the last webinar, where there's still more clarity needed around, pay cuts. When you want to impose pay cuts, how will you go about that? Will you need to give people notices? Are we still going to stick to what we had talked about earlier about negotiations? So what if these negotiations don't work, if the employee says no? So just a process, if you could give us a brief outline of that process. And then for the three of you, there's a more like something you had addressed basically earlier, but Professor Martin Njoroge wants to get your opinion on a scale of 1 to 10. Is the leadership in developing countries, such as the East African region, doing, how well is the leadership, rather, in developing countries doing to help manage health-related challenges affecting the citizenry? And when benchmarking with global patterns and strategies being employed in developed countries, what proposals do you offer to leadership in Africa for a better way forward? Then he goes ahead to say that it's a great webinar, very informative. So I think we will end on that note with each of you giving your perspectives on that issue. And Raimond taking up the question on how to go about implementing these pay cuts. Okay. Because I think the closing remarks I wanted you all to make, you've actually made them in each of your presentations this last discussion. So please go ahead, Raimond.
Okay, thank you, Helen. Yeah, just to be brief on pay cuts, what I'll say is pay is a very critical component of an employment contract. And employment contracts are actually personal contracts, in that employment contracts are not contracts, it's not a contract between the company and the staff. Mm-hmm. An employment contract is between the company and that one individual. So, and we know our pay levels actually vary. We may be in the same job grade, but we are actually being paid differently based on very different dynamics, our experience, my history, or how long the company had looked for me, where I'm coming from, very many dynamics. So employment contracts are actually very personal contracts. So it's company and the person, not company and the department, or company and the staff in general. So critical component is it's a time for engagement, and it's a time for negotiations, and it's a time in which we are all in this together, leaders and employees. So the first and foremost issue is for that staff to be able to understand why that proposal is being made, because he has to understand the business, how it's performing, and how that business relates to their survival within that particular enterprise. Because if we maintain on, and actually this to the staff, if the staff insists, be it the union or the individual staff having that conversation, if they insist on retaining the current remuneration that is there, or even some, like some are doing currently, demanding for actually pay rise, it may lead actually to the company now taking very advanced decisions, which may come to redundancy. So it's just to have a conversation, and for the leaders, key is for you to be able to ensure that your people understand the journey that you have walked. When things have been okay, now things are not doing okay. Can we still walk through this journey together? And that assurance that yes, this is temporal, but again, we don't know the future, because it may be a pay cut, which we've discussed, the staff has agreed, and we need to reduce it into writing for the parties to sign, because that's what the Employment Act says, in that after the conversation with the staff, that agreement needs to be reduced in writing. And then that agreement, because of COVID is not permanent. So in that agreement, it has to be very clear that yes, these are measure that is to prevail until the company now picks up post-COVID. Mm-hmm. You may not put a period, because you don't know whether COVID is ending in January or whether COVID will be with us December 2021. But you may actually be able to put an indication, the parameters to which you will be able to say, yes, we'll still come back to the table and return to where we were, or be able to adjust our pay to even better levels than where we were in 2019. So that conversation, reducing it into writing, having both parties to sign. Let's not do chuakali things where we'll have phone calls, we send texts, or we just send emails, but it has to be an issue of we discuss and then reduce it into writing, be able to communicate to the staff. And because we are not working on physical documentation, yes, you will send the letter on email, and you'll still request for the staff to be able to confirm through email that yes, they understand the content and they're in agreement. Now, on the other aspect, if the staff is not willing to be able to agree to the pay cut, now as an employer, you've explained the situation to the staff. You have the decision to make if your business will be able to sustain the salary levels, or you have to make tough decisions where you have to release people on redundancy, because as a business, we can't be able to afford these pay levels. So that means that now you have to declare the staff redundant to be able to manage your costs, because as Jack has indicated earlier, liquidity is actually a very key component currently. So it's something that people are still focusing on. So even when the leadership is asking for pay cuts, it's just to manage the costs. So that's the steps I'll be able to go through and ensure that yes, we have the agreement in writing, but let those agreements not be permanent. They need to be, it's just a step gap measure to be able to ensure that yes, we walk through these and we survive through these, and we'll still be able to hold hands and celebrate when things are looking up. Yeah.
Thank you,
Raimond. And then lastly, what you had said, the proposals on
your reflections on how the region generally, the leadership in the region.
Yes.
Is, yeah.
Just in one line, my response to that will be, we're in this together, so we need to pull together as countries, as continents, and as a global community to be able to ensure that yes, we are healthy, and then we can actually be able to sustain our economies going forward. Now, coming closer home, Kenya and the region, I'll talk much more closer home, Kenya. The region, because we may not have information on some of our neighbors as to exactly what they're doing as far as COVID is concerned. But for Kenya, the comment I'll be able to say is that we're at a very unfortunate situation, because even as we talk about insurance, George will be able to agree with me, it may be less than 20% of the population who actually have either an NHIF. Jack is now being able to tell me some other figure which it's surprising. 2%. Now, who have actually either an NHIF insurance cover or the former underwriters, the UAPs that we know, the pioneers that we know. It's a very unfortunate situation because now it means even this insurance that we've been talking about, you can see the numbers that you're talking about. Otherwise, the entire population, they're actually left for their own masses. Still, when you talk about lockdowns, there are people who are actually living hand to mouth. So they actually can't be able to stock anything for any lockdown because I have to work today for me to be able to be paid tomorrow. And then also, like our country, we've done well. And even that decision to open up the counties and to be able to have movement and business going, it's because of the economies. Because yes, it's a health issue, but we still have to eat. So if we can't eat, then it becomes a problem. So the government is actually really balancing well, and it's doing well. It's just that as a people, we need to do more for ourselves and for our neighbors to be able to do the simple aspects of washing hands, social distance, and being able to sanitize as much as we can, and ensure that at any given point, we don't get to the 1,000 plus, where now our hospitals will not be able to manage. But for now, both on the economic aspects and even from the banking, you can actually be able to see in the papers today where banks are reporting that as of now, banks have actually been able to restructure loans in excess of 800 billion, where people have actually gone to banks. And actually that is like almost like 30% of all the loans that are there in the bank's books in Kenya. So you can be able to see, and that is an issue of banks working together with government to be able to see how we can be able to support our small businesses, our individual people who have to have some breathing space as we wait for things to pick up, and then they can still be able to go back to their businesses. So as a country, I'd say, yes, we are working well. Let's keep to it. Let's follow the guidelines, which are actually being given by the Minister of Health. And also, I'm proud in that government, like the Ministry of Education, the decision they have taken today not to reopen the technical institutions, universities on 1st of September, is a very key leadership aspect in that as a leader, you can promise your people that, yes, come 1st of August, I'm going to do this. But when you assess and be able to realize that, yes, actually, that 1st of August is going to lead you into some ditch, you'll still come back and be able to say, no, I've changed my mind. Because actually that's all about leadership. You review risks, you evaluate them, and be able to give timelines, be able to review those timelines. So government has actually been very good at working on that, reviewing some promises that actually they have given us, maintaining some things that even are very unpopular to some of us or to the general population. So we've done well. So key is to the general population to be able to take up our roles at an individual level to be able to ensure that, yes, we do the little that is being asked of us, and we'll be able to, actually that's the cure for COVID, the little steps that we are being asked to do. That's the cure. Thank you.
Thank you.
And also just lastly, just lastly, my last comment will be that Jackie has mentioned about the vaccine, and I know George may also be able to comment on this. This vaccine, again, there's a comment from the doctors. You know, vaccines are actually for babies, young ones. They have very strong capabilities to cope. Because you know what we know, vaccines actually, the disease is being introduced to you, in that now your body develops an immunity to cope into the future. Now, there are people who have underlying ailments, and there are people who are elderly. Actually, from the medical world, that category actually is not, it's not advisable for them to be again vaccinated, because it's actually this disease which is being introduced to their systems, which systems actually are having issues. So even as we wait for the vaccines, my plea will be, yes, let's just do what we are doing and keep the vulnerable safe, because even when that vaccine comes, that vulnerable groups, you may vaccinate the person and actually the person may die of that disease. That's actually the reality in the medical world. There are some kids who have been vaccinated and actually they are not able to cope with that disease that has been introduced in their system, and actually it leads to that. So the protocols that we are having are going to be with us, and they are very, very critical, because it will actually just not be a one bullet to be able to solve the problem. Thank you.
Thank you, Raimond. Jackie disappeared from the screen.
Here, and I'm here. I want to answer Martin's question around the scale where we would rate the developing countries. Before Raimond spoke, I was ready to rate us at a 3. I'm now persuaded to move it to a 5. However, I think what this pandemic has revealed is the soft underbelly of our poor public services in terms of health, water, sanitation, education, everything, and also our very nascent social welfare systems. So how do we respond when we benchmark with global patterns? I think it's really been a challenge to our political leadership to figure out how to address those inadequacies in terms of public services and in terms of social welfare. And Uganda was a little bit ahead of us in terms of the social welfare aspect. I think they were able to provide, at least as was reported, they were able to provide food, for example. When they told people don't go to work, they were able to provide certain services to the people. Tanzania, I think, seems to be on the path towards let's develop our herd immunity. Let's see how quickly we get to the peak and then deal with it at that time. Here in Kenya, we seem to be able to generate income as a nation, but our deployment of that income is the challenge. So the challenge to our leadership then is how do we develop our social welfare systems in terms of, for example, health insurance, pensions, and then the public services, water and sanitation, health facilities, and of course, education. Right now, there are very many children who are disadvantaged. In fact, that's why the government probably had to take a long look and say, look, nobody has been learning. Let's go back to the beginning. Nobody has been learning since March. Let's not say that because some people were able to access online learning, that there has been learning going on. The reality is there are many children who were disconnected from education when the schools closed. So we cannot therefore say that learning has been going on. And even if you look not just from a health crisis perspective, but any crisis, imagine if it was a hurricane or a typhoon that had affected this country, where would we be in terms of our response? And for me, the answer was that Kenya, as a nation, did not have a business continuity plan that catered for public services and access to social welfare systems. So that's where we need to, I think, focus our energy as a nation, and also look to where the opportunities are. We have a latent capacity for local production. Why should we be using masks from China, for example? Why can't we develop that capacity and focus on manufacturing and the other sectors that the government has spotlighted in this most recent budget in where they need to focus their energy? So if we were to follow everything that's on paper, we would probably be way ahead of where we are now. But I think the diversion comes in through mismanagement, for example, of funds, or just a lack of commitment towards delivery. So I think the opportunity lies in proper commitment towards public services and towards social welfare systems. Thank you.
Thank you, Jackie. And finally, George.
Thank you again, Helen, and I will not want to repeat what my colleagues have said. Apparently, I also happen to be a citizen of the region, so I will not talk ill of any of the country to be politically correct, or else I'll be quarantined not to enter a few of them. And I want to start that just to bring something on what we are discussing before, that we are simply saying this fight is also for the employer to be able to help. And one of the things that I want to encourage the employer is to have some, what we call medical funds that will be able to help the staff in the event that the insurance and the others will not be enough. So we normally call it third-party administration that can be done for them. And so it's very, very critical that we set aside some funds that whatever is not covered in the insurance or other medical, then we come in. The penetration of the medical insurance, actually, as we are all aware, that the nearly 80% of people who are covered and slightly above 80% is actually NHIF. The insurance companies probably are taking only 10%. And then you have community-based health schemes, which probably another 3 to 4%. Then you have around another small percentage of that are done by around 23%, whereby by those which are health managed organizations that are dealing with that. Insurance penetration probably at around 3% or 2.7% in Kenya, but we're simply saying in the medical part, the government still plays a crucial role to be able to manage the health of the nation. That's a fact, and therefore we cannot run from it. Let's come back to what then, if I look at the leadership of the region, and I don't want to single any country, let them know themselves. One, I think the role of the key government currently to help us is to ensure that we have enough healthcare facilities and personnel, apart from what my colleague have said on the PPEs and everything. Social support is very, very important at this. But I want to say one thing. Apparently, COVID has wings. It flies. What does that mean? It's moved from one country to each country. And what we are seeing is lacking is the coordinated effort in the region to be able to contain this ugly COVID pandemic. And I think our leaders need to play more diplomacy to work together. Let the resources be given together. Let us have laboratories that will be shared, that we are able to do the testings as fast as possible. Let's issue the certificates within 6 hours. Why not, if we do this? Why should people be moving around and the business economic aspect is affected because we have trucks waiting at the border to be cleared because of just a single certificate? We want our government to work and walk in one accord as much as possible. We want them to stop stigma. We want to now address the issue of accepting that COVID is not killing Kenyans more than malaria, nor HIV. We need to ensure that we manage this information and message. We need to empower social leaders, our community leaders, to spread the word to fight this COVID. As much as we are able to do that they are taught, they are able to be our ambassadors on the ground. So opinion leaders will become very, very critical on fighting this. We need to get involved in the research. We have brains, very good doctors in this country. What are we doing? What are our scientists doing? Why can't we not be on the forefront as a region and as a nation so that we are able to win this war as much as we are able to do? Lastly, let's stop corruption. Where the funds have come, can we account for them? I will not rate our leaders and our region because I think it will be bad to compare ourselves with the rest. But we are saying, let's do it in an African way, the regional way that is going to be first class, to be alluded to and every people to imitate it throughout the world. Let's not compare ourselves, but let's be the best. Let's be the leaders. Thank you.
Thank you very much. Just to wrap up, I will reiterate what I said at the very beginning when I was giving the opening remarks as we talked about proactive risk management for recovery and resilience. I think we have done justice to this conversation. And as we conclude, I just want to say that my takeaway from this moving forward is that organizations need to basically, if they haven't already, put in place recovery plans, work very closely with their risk teams, to interrogate the blind spots and weak links exposed by the impact of COVID-19. because as Jackie said, you know, it's bigger than the Titanic, and we are in it together. And so we must find a way to not sink, but to survive and stay afloat. So a very heartfelt thank you to Jackie Oyuyo Givinji, Raimond Molenje, and George Alande, particularly for accepting to join us at such short notice. For those of you who don't know, the facilitators know, I actually contacted George yesterday. He agreed to join us and lead the discussion and offer insights from an insurance perspective. And you can see we've learned more than insurance from him. So I want to say a very heartfelt thank you to the three of you, to the participants, for those who stayed with us through the long haul, those who left. I know we were still together even when you were here. And to, of course, my techies behind the scenes, Salome and Ernest Mwanzi, and of course to USIU Africa, without whom we would not be holding this webinar today. So thank you all, and God bless you, and please do stay safe. Wash your hands, sanitize, maintain social distancing. Let's take this very seriously because as we can see, the number of infections are going up, and we need to do all we can to take care of ourselves and each other. So thank you all.